Hello, good morning everyone. Now in today's video we will discuss in detail about how to prepare for DNB pediatric practicals, different section wise, like how to prepare for OSCE and how to prepare for cases. So just in short, I am not going to take much of your time. So for OSCE, you have to go through images. The questions are mostly image based. So you have to go through images. Just take a single book, either Piyush Gupta or Nelson, whichever you are reading through and through. So go through images of those books system wise, like once you start respiratory system, just have a look at all the x-rays, CT images, whatever different graphs or spirometry things, whatever it is given and you feel it can be asked in OSCE. So just have a look on those images and read what 2-3 lines are given below that image, like the lines which are explaining that image particularly, CT scan findings or x-ray findings mostly. So first just start from basics. First clear your x-rays, just don't jump to CT scans or MRIs, okay? So because we just need 50% marks to pass practicals, you don't target 70-80% at first. Those are for bonus marks. Just target that you have to get 50% to pass your pediatric practical exam. So focus on x-rays first. I'm just taking example of respiratory system. So basic simple x-rays. Even we commit mistakes in diagnosing pneumothorax sometimes. They ask pleural effusion, pneumothorax, diaphragmatic hernias, two simple basic x-rays which you come through in your daily clinical postings. So just go through those simple images and read basic theory for those images. Like if an image is showing lung abscess, then just go through the topic of lung abscess in short. Most common organism causing lung abscess, or drug of choice in case of lung abscess. A few important points of epidemiology of lung abscess. Meanwhile, if you are reading CNS, central nervous system, and you are going through neurofibromatosis, something, the image is showing pictures of a baby with neurofibromatosis like cafe aloid spots or Lish nodules. So just go through those images and then in short the theory of neurofibromatosis. Mostly they ask about in pattern of inheritance. This is a very important question and very scoring question, but we usually commit mistakes. Like they will give image of tuberous sclerosis, and you can diagnose tuberous sclerosis easily, but after that they ask about inheritance, and sometimes we commit mistake in those. At telangiectasia, they give image of conjunctiva showing telangiectasia and different findings, peculiar features of telangiectasia, and then they ask about pattern of inheritance or chromosome involved, or in some where the definitive diagnostic approach is there, or any definitive treatment therapeutic modality is there. So they will ask about those things. So each question in OSCE comprises of 4 to 5 sections. Question 1 comprises from A, B, C, D, E. So either all section will get any different image, like if they might ask 5 different x-rays and just they will ask about diagnosis. But usually what they do, they give an image and then they ask 2-3 questions about the different aspects of that image, like diagnosis and inheritance, or investigation of choice and treatment of choice, something like that. In few sessions they have also asked, they play some videos and they ask that they have to find out the mistakes about those videos. So like some procedure, for example, resident is doing lumbar puncture or pleural tapping, something like that, and they will ask what mistakes are there in this procedure. So you have to know the steps of all those procedures also. So there is no limit in OSCE, anything can be asked from anywhere, but our aim is, again I am stressing on this, our aim is to just get those 50% marks. So first start from basics and just go through a single book. Even I will say we can start with OP Ghai also. They are sometimes images which are very easily available in textbook, very standard textbook, which is OP Ghai, which we start reading from our MBBS days. So any image from any standard pediatric textbooks which we are reading in our country, you can go through them, and you can be in a comfortable position to answer in OSCE exam. And next, what you can do, there are various online classes or online groups or Telegram groups or YouTube channels, whatever things. But I am again saying there are plenty of them everywhere. Many of the institutes are giving very good lectures on OSCE pattern, but you should follow only one or two of them because you don't have that much time. Now only around 20 days are left and you have to revise also. So just don't try to view, watch or read each and everything. Just stick on few things and revise as much as possible, because revision is the key. Just reading everything and then forgetting everything the day before exam will not fetch you good marks. So in short, just grab a single standard textbook, go through all the images as much as possible, and no need to go through the PET scan images or something like that which are given, or some very complicated MRI or CT scan which even if you are reading, it's not possible for you to assess them properly in exams. So you just assess yourself and just start with basics. First clear your basics and then jump to the next step of preparation. Okay, so thank you very much. Next video we will discuss about how to prepare for cases and table vivas. Thank you.